Okay, we're live.
Super. Okay. Good afternoon, everyone. I'm Councillor Liz Fairhurst, and I'll welcome you to this decision day. If we go straight into the agenda, the first one is a procurement of a carer support service. Is that Jonathan? No. Katie?
No, it's Katie.
Katie, yeah. Sorry,
Yeah.
Katie.
That's fine. Good afternoon, everyone. Yes, this is a request for permission to spend for up to 7 million over a period of up to 5 years. And it's for the procurement of a new contract for a county-wide carer support service for adults. Carers being family carers, so people helping family, relatives, neighbours to stay independent at home for longer. And in doing so, they are helping us as carers to prevent and reduce the need for formal social care provision to the extent that it might be needed without their input. So this new reshaped service is intended to contribute towards the council in preventing and reducing and delaying the need for care and support of adults in our area, and also for the need of support for carers. So the current services that are in place that are related to carers are due to end at the end of August, and this reshaped service would have a new specification extending the reach and the depth of the support that's offered for it to benefit more carers, and to take into account more of the complexity that carers are facing in their situation, and in terms of the needs that they're supporting people with at home. And so it would be county-wide, offering 3 main elements: information and advice, direct one-to-one support, and contingency and emergency planning. And alongside the service delivery, there is an expectation that within the service specification that the new provider would be a partner with us to help continue to develop the service and to work with us as we continue to develop our support for carers to achieve their outcome. So in terms of the purpose of the overall purpose of this service is to really support carers in taking on that role and to sustain that role, and in doing so to maintain and improve where possible their own health and well-being, so it just becomes much more sustainable in terms of their input and support for individuals. So that's a quick summary of the service that would be in place, and the request is for the permission to spend for the procurement to go ahead.
Thank you, Katie. I mean, I think this is a really vital service. I mean, carers do such an important role, and I picked up particularly on the fact of emergency planning, because a lot of family carers, they do not have a plan in place if something goes wrong with the carer, and that can lead to a real breakdown. So yeah, I'm delighted by this, and and going out and finding more carers, because again, a lot of carers are hidden. We don't know them yet. And the sooner we get to them, the sooner we can put in the support and make life easier, hopefully. Yeah. Okay. Jan, do you have any questions?
Just a comment. I think it's a brilliant paper, Councillor Fairhurst, and thank you so much. And Katie, how do we reach those carers that we haven't reached, if that makes sense? Is there a sort of comms or a plan to let them know about this fund?
So there would be internal communications from our communication colleagues about the new service starting, and then in conjunction with the work that we currently do and the role that we have within the Hampshire Carers Partnership, we would be making sure that those partners were aware of it. And then built into the service specification would be communication and engagement expectations on the provider to make sure that not only do they do that general promotion, but built into the service spec would be the focus on making sure that it reaches people that would not necessarily normally be reached. So in terms of equality and inclusion, it's very much would be built into the service spec requirements.
Brilliant.
It's really important to make sure that people are aware of it and to not just only certain groups of people.
Of course.
Thanks. Graham, did you want to come in then?
Yeah, thank you. It's just to build really on what Katie has just said. So this is part of work that I think could helpfully be seen and around. So we had an absolutely fantastic co-produced carers strategy, which Katie and carers and colleagues have led on, and it's included representation from all of the carers representative groups, carers organisations. So in terms of that understanding, that knowledge, that sits out with many of those organisations that we already work with, for them to continue to promulgate advertising in terms of, you know, support for carers in various forms. So this procurement will follow in the slipstream of that piece of co-production work. And also to say that we do continually reach out to all partners, wider partners, but also specific partners within, for example, the NHS, in terms of the kinds of services and support that are available to informal family carers and indeed others. So that there is a continuing job to be done just in terms of advertising in due course, the Carer Support Service. There is a support service in existence already. This builds on that, hopefully, subject to decision going forward. And as Councillor Fairhurst has said, it's absolutely vital for all of our residents and for our social care services that we absolutely advertise the support that is available to informal carers, because the thing that we hear all the time from people that care for loved ones is, I just want to have some support so I can carry on caring for a loved one. I don't want to reach the end of the line, and this is absolutely crucial in being able to do that. If I could be so bold, Councillor Fairhurst, I just wanted to add as well, as is usual, we offered briefings to opposition members earlier this week. We met with Councillor Tree, who was supportive of not only this, but all of the papers to be discussed this afternoon. Councillor Taylor was unable to attend, but also informed me verbally that she was in support of the papers and the proposals before both yourself and Councillor Warwick this afternoon. Thank you.
Super, thank you, Graham. Bill, do you have any questions or comment?
No questions. I think everybody said, I think this is an exceptional service that's going to be provided, and the importance of communication cannot be understated. And the fact that the feedback from organisations that are involved in the system at the moment, you know, demonstrates that, again, we're looking to cover future needs. The only thing I know, it says 18 upwards, but it is getting out to those educational organisations where we know there are people that are trying to do two things at the same time: care for their families and continue their education. And are we getting the message out to them?
Katie?
I think it's a really important point in terms of the wider scope of younger carers. And we are, alongside this sort of support service, we are, as Adults Health and Care, working alongside children's services. And they are part of the Hampshire Carers Partnership as well, which has been referenced in terms of the overall strategy, which very much is reflective of all age groups. And so within the service specification for this service, we've very much embedded in there that young carers be identified and supported in terms of contact to the local support groups, so the young carers groups that are available in Hampshire, and also to children's services, and so to pick up on their needs as well. And I think it's a continued area of work and development to make sure that we make sure that we have a reach out to all carers, because there's families with many people that take on these roles, so we want to make sure that we reach out to them. So just to reassure that we're doing some work alongside this support service as well, but it is embedded in there as well.
Thank you.
Right, well, thank you, Katie. I'm more than happy to approve this, and be interesting to see how it goes. But so thank you very much. But super report, and good luck for the future.
Thank you.
Service. Okay. Right, the next thing is an appointment to Hampshire Hospitals. Do we know who's recommended these two people? Is it Georgina and Jet to be on Hampshire Hospitals?
Yes.
Do we know where
right.
we got? Sorry, Katie. Do you know where the recommendation came from?
I'm not entirely sure where it came from originally.
If I can assist, Katie, if that's okay. The way that we've operated over a number of years now, Councillor Fairhurst, is we've asked Winchester University to make nominations. So typically within the student body, that's where nominations are drawn from. and clearly on the basis of young people, students of the university, once their studies are complete, not to say they all move on, but some move on. So that's why we have, on a fairly regular basis, nominations coming through, typically from the university. And that's my understanding for these two nominees.
Thank you, Graham. And actually, we've got two rather than one this time, but actually, I'm very happy to nominate both of them if they're willing to do it as students. That's good news. Yeah, thank you. Now I'm going to hand over to Councillor Warwick now, because I think it's come to her turn, if you like.
Indeed. Thank you so much, Councillor Fairhurst, and welcome to my continuing D-Day. I'm the executive member for Younger Adults Health and Wellbeing. The final paper we have is the Demand Management and Prevention Grant Awards, and I'm very happy to hand over to Peter, who's going to introduce the paper. Thank you.
Thank you, Councillor Warwick. So this paper before you today is seeking a recommendation to award grants totalling a sum of £87,612 to cover a range of time periods between June 2024 and November 2025 as part of our Local Solutions Fund scheme. So this scheme is provide sort of one-off startup funding to activities in local areas where there's been identified gaps and there's identified need to enable people to live independent lives away from requiring adult social care and to prevent adult social care. The grants before you today, the first one is a grant towards Happy Healing Hut, a grant of £30,000 for a period of 18 months from June. This is a project which is staffed and operated by mental health professionals who work in the NHS, but this is their sort of a community interest company. And this is to work with those who have been in hospital, who may be receiving physical support in terms of physiotherapy and everything to get to regain their mobility, but maybe lacking confidence. So this is more about the emotional and sort of mental support which goes along that to enable people to re-engage with their communities, because we know that it's not just the physical, it's also the emotional element. If they don't have confidence, they often won't go out, so they won't regain that mobility, and equally that will that diminishes their well-being, increases their social isolation, and then can lead to social care. So this project is to work with people over a 12-week period to build up their confidence and so they can re-engage with their communities. The second of these grants we're seeking for award is to First Steps New Forest. This is a grant of £7,000, again for 18 months from June. And this is to work with the settled Gypsy and traveller community within the New Forest area to prevent homelessness, but specifically those younger adults who may have additional learning disabilities or and trying to engage and maintain that support within that family group, rather than requiring sort of being made homeless or may require additional support from elsewhere. So it's kind of doing some of that brokerage work as well as kind of supporting the family to maintain that sort of care for those individuals. The third grant is a grant to Fawley Community Centre. This is a grant of £21,000 for 18 months again from June. This is building on work they already do in terms of both social activities and also sort of physical rehabilitation of people. So I'm working with older people who have specialist equipment, and this is looking to build their specialist equipment for those who have maybe been in hospital, who may have at the moment some limited mobility, to help regain their strength so they can maximise their independence within the community. Alongside that, recognising that there's actually a double element in terms of emotional support as well. They're also increasing the frequency of their social activities, which will surround and kind of interlink with these sessions to enable people to have a purpose to leave their homes and always fulfil that purpose to get out and also exercise and to build those, re-engage and build new friendships to kind of move forwards with, in terms of their recovery and hopefully avoiding adult social care. The fourth and final of the grants is a grant to Basingstoke Neighbour Care, a grant of £29,612 for a 12-month period from June. This is to build, to form a community hub in the Popley area of Basingstoke. They have delivered a community hub in another part of Basingstoke before, and we know that was successful. This is to kind of look to build this in Popley, where we know there's a need in terms of social care needs, so it's looking to address that. And it's designed to be self-sustaining. So once it's initiated, almost the funds from those members who will be going will continue to support it. Alongside things such as community cafes, which this hub will provide, it's also going to bring and align other services to it, such as the local citizens advice, and also for such services such as a toenail clinic, because often recognising that can be an issue in terms of mobility for individuals. So those sort of activities will go alongside it, so people can go there, maybe socialise, but also receive other additional support, which in a in a way which won't stigmatise them, and it's almost easily accessible for them to maintain their independence within their community as well. So in terms of all these grants, these will be funded out of the current budget envelope set within 24-25, and all the money will be spent within this current year in terms of all the award we made. As you're aware, the County Council has recently consulted on the proposal to withdraw funding to adult social care grant schemes, and the Local Solutions grant is one of those which has been consulted upon. However, that is from April 25, and so hence it does not affect the impact of awarding these grants in this current financial year.
Thank you so much, Peter. Well done for coming up with such a range. I know you don't come up with them, but you managed to garner grants from across the blooming whole of the county area, and the toenail clinic sounds fantastic. That's brilliant. Councillor Fairhurst, do you have any comments on these grants? Liz, I think you're.
Yeah, I'm with you now. Sorry.
Yeah.
No, I think they're all really good grants. I must say I'm most impressed by the one to the Gypsy and Travellers, because I think sometimes they're the most marginalised of people. And I think anything we can do to help them can only be a good thing. So, but yes, all the grants are good. But as I say, that I would put that top of my list. Thank you.
Thank you. Councillor Withers.
Well, I think I'll put my best foot forward on this one with the toenail clinic, because to me it's very important, particularly for people with diabetes, to make sure that they look after their feet, and obviously stability in balance for elderly people as well, being able to move. The Travellers one, as long as they don't keep going into medical centres on a Friday night and staying there the whole weekend and disappearing with the court order on a Monday after doing severe damage, with your kids jumping on everybody's cars, maybe a grant to educate them and help them out socially, it will be very useful. It's almost like a double-edged sword in many ways. On the one hand, they're a pest in society, and on the other hand, we're trying to give them a good start in life. But it is important that we do. First Steps has got a very good reputation, and it is important that we do it. I think the 29k for Popley Community Hub and the social care, as we've said, and the social cafe is very important. The success of the food hubs, with the inclusion of a desk for Citizens Advice Bureau, for also social prescribers being there, has enabled those people in our deprived areas to actually feel comfortable about talking about their situations in that type of hub. As opposed to going to the main building and sitting across the desk. So I think it's very important that we do support that grant system.
Brilliant. Thank you so much, Councillor Withers. And I think, Peter, one of the grants is a little bit high because they were purchasing equipment, I think, wasn't it? It sort of jumped out at me. But once that's purchased, that will last for a decent period of time.
Yes, so very much that's the case. So yeah, so all the equipment's purchased, but it also will fund those other activities and enable them to kind of go around it, if that makes sense. Although the activity cost is the smaller element of it, but no less important. Brilliant.
Thank you so much. So Jennifer, I'm very happy to approve the suggestions in this paper as part of my D-Day decision. Thank you. So I think that's the end of our D-Day. And we're happy to stop the broadcast now. Thank you so much.